Okay, good morning. I hope you understand my Portuguese. It's not so good. But thank you very much for coming all here, and also thank you very much to the leadership of AC Camargo for inviting me here to speak. I've had a wonderful 4 days so far, seeing what AC Camargo are doing in this field of cost of cancer care. It's a tough subject, okay? But what I've seen at AC Camargo is really they are starting to do amazing things here. And I think that the world is going to start to learn from some of the things that are starting here. Okay, just to introduce a little bit, I just want to say a little bit about who I am and what I am and why I'm here. I'm a doctor. That's my basic fundamental principle. I'm a doctor. I care about patients. I treat patients, and that's my guiding light, my guiding principle. Okay, and I treat individual patients. I'm an oncologist. I treat genitourinary cancers, so prostate cancer, kidney cancer, and I have young men with testicular cancer as well. So, and I treat a lot of patients with those types of cancers. But at the same time, I also think about populations and how to help populations and healthcare systems in order that we can have a system that can help us to be able to treat these patients. And so I'm involved in research and policy, involved in many different organizations. I'm a professor at Tel Aviv University. I advise different institutions around the world, like the NHS, insurance in the US. I worked for 4 years on the payer side and the insurance side in Israel, and also guide different policies and things within ESMO, the European Society of Medical Oncology. Always trying to think about the economics of cancer care and make it patient-centered. And while I do these things, my work in the clinic helps me think about the work in policy, and at the same time my work in policy helps me think about how to treat patients better as well. So when we start to think about, I've been working in this whole field of the costs of cancer care and economics for the past 10, 12 years. For a while at the beginning, it felt like Sisyphus. This is a picture of Sisyphus, if you know your Greek philosophy or Greek stories. And it felt like we're pushing a big rock up the hill, and it's really hard. And I'm sure that you can all feel this on the payer side in insurance companies, that there's just the costs are just tremendous and they're increasing. But thankfully, over the past few years or so, there's been more and more organizations that have got involved and started thinking more and more about this and trying to grapple with these issues so that we can guide policies and guide principles in an appropriate way for patients. So EORTC, ESMO, and there's a grassroots organization called Common Sense Oncology that is now worldwide. We have a meeting in a few weeks' time in Montreal, and Dr. Raquel will be coming from AC Camargo. She'll be representing AC Camargo up at that meeting in Montreal, where we're grappling with these issues about costs and patient-centered care, trying to improve the systems that we're working in. And there's a little space there because I think that we can now soon put AC Camargo's logo onto that. We can already go there now.